Welcome to Abundant Life Lifestyle Center. We are here to demonstrate you a simple hydrotherapeutic measure. It is called the heating compress. What is a heating compress? A heating compress is simply a cold cloth that is tied around any part of the body which is covered by more dense woolen cloths, and heat is prevented from evaporation and the body heats up the cold cloth. So it's called a heating compress because the body heats it up. So, what is the principle behind the heating compress? In a heating compress, we employ the hydrotherapeutic principle of reaction. Okay, whenever we apply anything hot or cold, the body tries to do the exact opposite of the temperature that is applied over it. So, for example, when we apply heat to any particular part of the body tries to cool up that part, and the body does various things to try to help elimination of heat, and we'll be learning more about that. So in a heating compress, we are going to employ the principle of reaction. In hydrotherapy, when we apply heat to any local part or cold to any local part, there are local effects, and this heating compress is going to be a localized treatment. It is not going to be a generalized treatment. So, when we apply a cold cloth over any part of the body, the initial response of the body is that when cold is applied, the blood vessels constrict. So, the part of the skin over which we apply the cold cloth is going to have vasoconstriction. And the body tries to produce a reaction, in the sense the body tries to heat it up so that there is vasodilatation. And this principle of reaction lasts longer and is more stronger than when you apply something hot or cold directly. So, when the body produces a reaction, and the effects of the reaction last much longer and they are much more stronger, and that's the reason why we are using this principle. So let's understand this. When we apply cold over our body, the body starts heating it up, and then as the body heats it up, the body starts having vasodilatation. And when the vasodilatation is prolonged by prevention of heat loss from that particular part, the smooth muscles of the blood vessels in that particular part become paralyzed due to repeated stimulation and constant heat, because of which there is a prolonged vasodilatation. And this is the reason why we are applying a cold compress. The effects of a cold compress, when applied properly, can last for even 12 hours. Okay, so let's try to see how we can do this heating compress. Okay, so here we are going to demonstrate here to you today heating compress for the throat and heating compress over the chest. We are specifically doing these two procedures or parts because in this coronavirus pandemic, many people are getting sore throats, cough, and chest infections, congestion, and so we want you to employ these simple measures so that you can overcome this infection. The best results are obtained when you start treatment immediately with the slightest symptoms that you observe, and this treatment is so simple, anyone can do it at home. As mentioned in a previous video, mentioned that initially symptoms of coronavirus are mild and they last for 4 to 5 days. This is the best time for us to stimulate our immune system and to fight against this. In a heating compress, due to the long lasting heat, the WBC count in the applied part tends to increase twofold. These are experiments done many years ago, and now more experiments are being done on this. So we stimulate immune response and we increase the activity of natural killer cells and macrophages so that the virus can be killed and your body can be kept safe. The other thing is that when the temperature of the body is at a higher temperature, viral replication is decreased. So the speed at which the virus multiplies in any part of the body is reduced when that particular part of the body is at a higher temperature. So we are going to focus on raising the temperature over the throat and over the chest. So let's see how we can do this. So at this time, we are going to demonstrate a heating compress to the throat and a heating compress to the chest. So in order to help us with this, I request Ms. Sylvia to come, and she is going to help demonstrate this process. And let me share with you the things that you would need for this treatment. For the heating compress for the throat, we need a white cloth that can go around the throat, and we need a woolen flannel cloth. The flannel cloth will go around the white cloth and over the white cloth. We also need a plastic sheet which will go over the woolen cloth. So these are the things that we need, and we will use safety pins to secure the different cloths in place so that they don't move or they don't go away. And we obviously have some cold water in this basin, and we have two different thermometers here just to show you what these are. This is a laboratory thermometer. The first one is the laboratory thermometer can be used to measure temperature of different liquids. So we use this here to measure water temperature. At this time, it's very simple mercury thermometer which is calibrated to measure water temperature. We also have a digital thermometer. The digital thermometer is actually an infrared thermometer. It is used to measure body temperature, and it can also be used to measure surface temperature. We use the surface temperature mode to measure water temperature. At this time, this water is about 74 degrees and it is in the range of cool. Water temperature between 65 and 80 are in the cool range. 55 to 65 degrees Fahrenheit are in the cold, and anything below 55 is very cold. So we are going to use cool water here so that the reaction can be produced easily. Now to do the actual demonstration, we have a patient here who is going to help us to demonstrate this. So it is very important to understand that hydrotherapy depends on a large extent upon the patient on whom we are going to do, and the water temperature and the method that is employed varies greatly with each patient who comes and according to their individual disease condition. So for this heating compress for the throat, we are going to have the white cloth be dipped in water, and after being dipped in water, it is going to be wrung, and it will not be completely dry, it will be little moist, and this wrung cloth is going to be applied around the throat. And while it is applied around the throat, make sure that the hair is not going in and it is separate, and this is how you need to apply the white cloth. So you can always ask the patient if it is very tight, or if the patient is comfortable. At the same time, we need to ensure there is no air draft going inside the cloth which will prevent heat to be retained. So you can see here it is being secured with the help of pins. Any safety pins that you have at home can be used here. So once this is done, the initial effects of the temperatures come, but over this, we secure a woolen flannel cloth. If you don't have a woolen flannel cloth, you can use a simple socks or any other cloth that you have to go around the white cloth. You can see that the woolen flannel cloth is a little bigger than the white cloth, and it completely covers it and makes sure that there is no loss of water or heat around from the sides of the cloth. So this in many cases is sufficient, but this prevents evaporation of water and also secures the water inside, and also helps retain heat. But if you have a plastic around the woolen cloth, it is going to help retain the heat for much longer, and the effects of the treatment can be secured for a longer duration. So this is generally done. Plastic can be done when you would like to have the treatment last for a long time. So again, the plastic cloth is simply wrapped around the neck, and a safety pin is used to secure the plastic cloth in place. Now, special care is to be taken that there is no airflow between the woolen cloth and the plastic cloth, and that the plastic does not keep irritating the skin. You can see that the woolen cloth is the one that can be more tightly fit. This plastic is not as flexible, and obviously it's going to have some spaces in between, but it is good enough to prevent evaporation of water. So what happens when this treatment is done? How long is it done? So when this is done, the effects of the treatment can last for even up to 12 hours. So it's very easy. You just apply it around your neck, and then you can go to sleep and then take it off the next day. As I mentioned in when I mentioned about the principles of hydrotherapy, what this does is it actually causes a reaction in the body. The body heats up the cold water that we initially placed on the neck, it takes about 8 to 10 minutes for the heating up to occur, depending on how cold it was and how much energy the patient has. So, um, this temperature would last for, as I said, overnight, and we would have a lasting heating effect around the neck. So even though we applied cold water, it is called a heating compress because your body heats up the compress. Now we are going to show you how to remove it. It's very simple. You just take off the pin over each cloth, and then make sure that the patient is comfortable when you do that. And each cloth can be removed separately, and they can be washed and used again. Now, things to remember when you are doing this to corona patients is that you need to make sure that you are washing your hands, and you're making sure that you disinfect the cloths also. Generally, if you wash the cloths or soak the cloths in hot water for 20 minutes, the virus dies off. And it is safe to wash the cloth in a washing machine too. When the washing machine spins and dries, the heat produced generally kills the virus. So it is not necessary to wash the cloth separately too. And as I said, the treatment depends largely on the patient on whom we are doing the treatment. In case of very old patients or patients who are very sick, who don't have the energy to produce a reaction, there are a few other things that we need to do. The temperature of the water should not be very cold; it should be just mildly cool, so that they can produce a reaction. And there are a few other steps you can do to help favor a reaction before we actually do the treatment. So at this time, Sylvia is going to help us demonstrate cold friction over the neck, so that we can see how that will help in a reaction. So simply, you just have to take a gloves, dip it in cold water, ice water, which should be a little cooler than the water we use for the cool heating compress, and then rub vigorously around the neck, the whole area where we are going to do the heating compress. Usually, this produces friction, and friction stimulates the nerves in order to secure a more favorable reaction. The rubbing should be vigorous yet tender. It should not be uncomfortable for the patient, as you can see, and the more vigorous, the more better the reaction. Also, it should not be longer than 2 minutes. Anywhere between 30 seconds and 2 minutes is very important. So when it is very short, the reaction will be much more pronounced, but not less than 30 seconds and definitely not more than 2 minutes. So once this rubbing is done, then you can do the heating compress. When the heating compress is being done, and you have to make sure that there is no flow of air inside the cloth that you secure. If there is airflow, it is not very tight, then the reaction would be hampered. In fact, you may not secure a reaction at all. If a reaction is not secured, the effects of the cold cloth remains, and you will produce the very opposite effects and can increase congestion, increase the inflammatory process. So let us remember that it has to be tight. It has to be the temperature has to be such that the patient can produce a reaction, and it is simple. Yet there are times when we have to be careful, especially with making sure that the cloth is tightly around the neck, and uh, that there is no water dripping over the clothes of the patient, because if water would drip around on their chest and on their dress, that particular part will get cold, and that can harm the patient. So it's very important to be precise with hydrotherapeutic measures. Now we also would like to demonstrate heating compress around the chest. This is especially good for COVID-19 or any other lung issues, pneumonia or any other conditions. So in this case, we have here two bigger cloths, and these cloths are going to be used around the chest. So you can see here that the same process is going to be used. We are going to dip it in water, but we are not doing that right now. We are doing a dry demonstration, and secured around the chest, such that the cloth covers the back, and also the cloth would be going around the chest below the clavicle, or around the clavicle too if possible, which is a little difficult, and it is secured with pins. And on the lower side, it is just little lower than the xiphisternum, or the below the sternum bone. So this cloth is dipped in water. The larger the area, the more difficult to produce a reaction. So again, in old patients, you can do a vigorous rubbing so that you don't have to make it difficult for the patient to produce a reaction. Vigorous rubbing over the chest can be done in such a way that there is redness over the chest which can be observed. And remember, between 30 seconds and 2 minutes. And the rubbing should be done with a water that is little cooler than the temperature of water which we are using to bring the cloth. Okay, now once this cloth is in place, it is secured and heat is prevented from absorption by using a much more thicker woolen cloth. We use a Turkish towel here. So there are different towels that you can use. Just make sure that it is tight enough. And again, you can put a you can see how this woolen cloth is going around the cloth that was there before, and you can see that it is little bigger than the previous cloth that was applied, and it is just secured tightly. So this again can be left overnight. When this is done, the body does two things. Reaction is one thing that happens which produces heating, and when the heating occurs, the surface vessels are dilated, and as I said, there is vasodilatory effect, and the effect of the vasodilation is much more prolonged when there's a reaction followed by paralysis of the smooth muscles due to repeated nerve stimulation which occurs due to the heat. This treatment also produces a derivative effect. What do I mean by derivative effect? The derivative effect is that the blood from the collateral vessels, which are deeper vessels that are going to the pleura and the lungs, are drawn towards the skin, and there will be more redness. When you remove the heating compress, you will see that there is more redness, and that is a sign that you have done the treatment nicely, correctly, and there is decongestion of the lungs. As I said, this helps in stimulating immune response, concentrating the immune cells towards this particular part which is being treated. So again, in COVID-19, this is something that you would want to do to help fight against this infection which primarily affects the lungs. So these are very simple treatments that can be done. Now let's go over some things that we should remember when we do this treatment practically. The water temperature should be such that the patient is able to produce a reaction. A young patient can produce reaction even when the water is very cold. An older patient or a patient who is very sick would require much higher water temperature. Though it is not hot, it is going to be very mildly cold so that the person can generate a reaction. It's important for us to understand that water heat should be retained, and that's why we are securing it with a more thicker woolen cloth, a flannel cloth, or even a plastic around the heating compress can be applied to secure the heat, and it can be left overnight. So again, these are simple procedures that anyone can do at home. So if you are having any symptoms of COVID-19 or any chest illness, you can simply do a heating compress at home. And definitely, most severe cases, when you have more severe symptoms, always go get checked with a doctor and go to the hospital. And many times, the waiting period when confirmed cases are found and then the mildest symptoms are there, that is the time when we have to do aggressive hydrotherapy so that we don't develop pneumonia. Preventing a complication is much better than trying to treat it, and there's no need to simply wait, but rather you can do these simple measures at home which can definitely help you with dealing with the infection. So as you can see, these are very simple treatments that anyone can do at home. You don't need to have sophisticated instruments to measure water temperature and these things, but it is useful to do these things in a treatment center where we are going to use these treatments for patients who are really suffering. At home, you don't need any of these things. And let us remember that hydrotherapy is a scientific measure rational treatments, and these follow the laws of physiology and anatomy. And so what the way they work is through diverting blood flow. The way they work is through nerve centers and by stimulating the sympathetic centers and by stimulating the parasympathetic systems. So they have a scientific basis and they should be done in a precise way. You cannot do treatments in a very lax way and expect the same results. So even though they are simple, you need to follow the details for the treatment. So if you have any more questions, you can and let us know. You can comment on the videos that you see, and you can contact us for any more information. And feel free to share these videos. These may be helpful for many people who are still wondering or maybe worried because they may have some symptoms of COVID-19. We don't know if they would have, but many people are worried already.